I wonder every day when I'll get sick again and what I'll do. I have no means of getting help, just like everyone else who's uninsured. A change needs to be made, and to do that we have to understand the current policies, the difference between us and other countries, and what reforms can be made. First of all, 75% of Americans are uninsured. There is no universal health care. Obamacare, Medicaid, and Medicare are not universal. You can get them through your work, you can sometimes get them through DHS, but it really just depends. Health coverage is really hard to obtain. You know, 2/3 of people who do, they pay a lot of money for health insurance. And it's because most health care is owned by private companies who can keep you or drop you at any time. Ron Ralph says that, yeah, the U.S. is ranked last in efficiency of its health care plans. And, yeah, 12% state and local funds, no matter what type of insurance you have, it's owned by another company. The American Journal of Medicine says that also 62% of all bankruptcies filed in the United States are because of healthcare costs, because of medicine, because of hospital stays, because of treatment that they can't afford. People have to declare bankruptcy. It's really sad. Next, it's, other countries like France and the UK and Canada, they are all income-based. Their tax dollars go to healthcare. Some people in the UK actually will get paid for, like having a baby or taking time off of work because of a medical expense. They actually get money back from being in the hospital. And that is how the US ranks in other countries. It's kind of hard to read, but we're at the very bottom in quality and efficiency and for coverage care. It's pretty sad. And according to Dan Monroe of Forbes, we're last. It's really sad. These are some diseases not covered by health insurance. These are common everyday ailments that need medical assistance that we just don't have if we don't have insurance. It's really sad because a lot of people contract these diseases. I mean, a heart attack, that's death, that's life or death. Like, you're either going to die if you have a heart attack or you're going to live. And if you don't have health insurance, you're probably going to die. It's pretty sad. Also, according to Michael Moore, a documentary called Sicko, congressmen find it really easy to sweep reforms under the rug. In 1960, Ronald Reagan took the reform for healthcare and he literally made a propaganda video saying that if the United States conforms to social medicine, then we're obviously a capitalist society because, it's not one man works for another man's work. It's the United States goes by, this is how much money you make, this is what you get. If you don't make enough money, sorry about you. The same thing happened in 1993 when Hillary Clinton decided she was going to go for a healthcare reform, and she spent years trying to get this done, and instead of approving the bill, Congress spent that money on a 25th anniversary birthday for Peeps candy. So, why should we have socialized medicine? What's wrong with it? Well, as you can see, there's really nothing wrong with it. Less sick days, more people earn money, you get saved from poverty, and it's the world standard. The United States is one of the only countries that doesn't have socialized medicine, and it's kind of sad. Alright, considering this, we can follow examples and make a change. Healthcare needs attention, and the only thing we can do is petition and work towards a better healthcare system. It's really sad that people are going to die today and tomorrow and the next day because of no health care. In conclusion, if we just pay more attention to health care, it would be a lot easier to get things done. Less people would die and more people would be covered. Thank you.